Hi, this is Dr. Desmond White from Desmond White Liver and Gastro Center. Today I want to talk about a adverse effects, side effects, or dangers or harms of a health screening. Now, you may think that health screening is a benign thing. I'm well. By the way, let's define what is health screening. Health screening means you have been well with no symptoms. You go to a doctor's clinic or a lab or somewhere, a health establishment, and say, I want to do a health screening. And they check a lot of things. Okay, this is called health screening. If you have a symptom, you see a doctor for checking, it's not health screening, that is diagnosis. So if you have tummy pain, you see a family doctor, they refer to me for a scope, it is not health screening. Health screening means that you have absolutely no symptoms, and we are trying to pick up the disease before it causes symptom. So how do we know what is the proper health screening? To satisfy criteria for as a health screening subject, we need the following criteria. We need to have the disease must be common. Common things occur commonly. Common disease like cholesterol, diabetes. It has to be screenable. That means we can detect an early asymptomatic stage. Hypertension, we can pick it up. Hypertension, before you feel headache or have symptoms, we can check the blood pressure and pick it up. Hypertension is screenable. Some diseases like leukemia is not screenable. There are patients that have a normal blood count on routine health screening, and the 3 months down the road, bang, they have diagnosed with leukemia. Too bad, okay? So leukemia, for example, cannot be screened. A stroke cannot be screened. People, bang, they just burst a blood vessel, they have a bleed, and they go to coma state. You cannot screen a stroke, okay, effectively. So some diseases, disease must be common, it has to be screenable. And the screening test has to be cheap and easy and safe. So taking a blood pressure is cheap, is easy, is safe. Doing a cardiac angiogram to screen the heart problem may not be that safe, because when you puncture something into the coronary vessels, they may cause problem. When we do a CT scan of the heart, a CT coronary angiogram, there's radiation involved, so it is not entirely safe. The screening test should be cheap. So obviously CT check of the lung is not cheap. A screening test should be accurate. And in any screening program, we have to prove that the disease can be picked up at early stage, and treatment of the disease can lead to better outcome, probably with cost saving. So for example, if you diagnose something through screening but it's terminal, then maybe no point diagnosing it, right? You might as well just live a life happily until you diagnose it. So not all diseases can be screened. In Health Promotion Board website, you just type Health Promotion Board, health screening into Google. They show you the Health Promotion Board website. They tell you what to screen for. Basically, chronic illnesses like diabetes, hypertension, lipid, your body weight, whether you got obesity. It also screens for things like also recommends for female mammogram, as well as a pap smear once they are sexually active, and for both gender would be a fecal or cord blood testing or fecal immunochemical testing. So these are the things that we test for in health screening. Now, but so you say that, well, I'm fit and well, I come for health screening. If you pick up something, I investigate. If there's nothing, then it's fine. Okay, so what is the danger of health screening? Something that we don't really talk about with patients, we don't talk about in public. There are several risk factors for health screening. Number one is a lot of health screening is not cheap. For example, there's a specific health screening for gastric cancer. It's created by my former boss, Prof. Yu. It can pick up early stomach cancer in the studies. It costs several $100s. It's not that cheap, okay? Cost. Colonoscopy for cancer screening is not cheap. Colonoscopy costs probably $2,000 to $3,000. So health screening can be expensive. Number two is that even when the test is negative, there's something called false negative. For instance, we use AFP to screen for liver cancer among patients with hepatitis B or cirrhosis. We noticed that a lot of liver cancer, I estimate roughly about half or so, liver cancer can have normal alpha-fetoprotein. In other words, when you see a hepatitis B patient, you will just use alpha-fetoprotein to pick up early liver cancer. You may fail many times. So among all the liver cancer that we discovered, roughly half of them have a normal alpha-fetoprotein. So what do? We use combined ultrasound plus alpha-fetoprotein, so that when one fails, we have another one to pick up early cancer. But sometimes that's not enough. Some liver experts overseas even recommend a non-contrast enhanced MRI of the liver, a non-contrast MRI of the liver plus alpha-fetoprotein. Then you can take up a lot of liver cancer, even in the early stage. The problem is MRI is not cheap and the queue is very long, so it's not feasible in the local climate. So health screening can be expensive. Health screening can be complex. And another two things that people didn't realize that first, if we have a health screening that pick up something, maybe a cyst in the kidney, a nodule in the liver, a hemangioma in the liver that are benign, yet they may affect your insurance ability in future. What do you mean by that? When you buy a health insurance, they will say that, well, we are covering you for any illnesses in future. So if you already have any pre-existing problem, please tell us. If you have seen any doctor, please tell us. So for me, for example, I would say, well, when I was young, I have appendix surgery. So I saw Dr. Noy that did the surgery for me, I think 20 years ago, okay? So I need to declare. If I don't declare and they found out after that, then they will nullify the whole policy. So I've been, I may even be charged with fraud. So if you have seen any doctor, you have any medical problem, you need to declare. Having a health screening to pick up something benign, such as a nodule in the lung, nodule in the liver, even if subsequent PET scan, biopsy scan show that they're normal, you still have to declare to say that I was diagnosed to have a liver nodule by Dr. Y in 2015. He said that it is benign and no action or follow-up is needed. You need to declare this. And in some insurance company, they may think, hey, this person had a nodule in the liver, even though the doctor thought it was benign. But what if the doctor is wrong? What if there's something serious? So they may say that, well, we insure your whole body except your liver. So I've seen many patients with health screening that show something in the liver, some benign nodule, okay, that we thought nothing to worry about. Later on, when they buy health insurance, a few years down the road, the insurer say, hey, we don't cover this organ because you have something there. So I have to write memo and say that, well, something there is not serious, no need action, is benign. Sometimes insurance allow them to be in. Sometimes the insurance company say, well, we don't want to take any risk. The liver, we don't cover. So health screening does have certain kind of risk, kind of a problem. Number one is affect your insurability. Another problem that people didn't realize is that sometimes in health screening, we pick up many things that are benign. Benign means they are not harmful. In fact, most of the things that we pick up during health screening are benign. But you will end up spending a lot of money to find out, to confirm they're benign, and you may have to do it repeatedly. For instance, among people having a nodule in the lung, one nodule in the lung, even when the doctor thought it is benign, to be sure, we normally say come back every 1 or 2 years to do another CT scan. So even though we thought the nodule in the lung is benign, patient need to keep coming back for repeated or regular scan every 1 or 2 years. There's cost involved, there's radiation involved. Or someone someone do a gastric clear that show gastric cancer. It is positive, they come, we do a scope to check the stomach. We may end up picking up, the scope can be normal, but patients are subjected to the risk of a gastroscope and pay for the cost of a gastroscope. And I have patients that pick up nodule in the kidney, nodule in the liver that they spend money and time to survey them to make sure they're not cancerous, and they lose that organ became uninsurable because the insurance don't want to take a risk. Insurance like save patient. Okay, people never fall sick. So to sum up, if you have no problem and you go for health screening, follow the Health Promotion Board website recommendation. Look for a good family doctor under the Healthier SG. I expect a GP family doctor to be well-versed, well-trained into doing a sufficient, adequate, but nothing more, nothing less kind of health screening. And beware that doing more doesn't mean good, okay? When you go to see a doctor of health screening, doesn't mean that, hey, my company got budget. My company as an employee, pay for my health screening. Check everything from head to toe. No, don't do that. It may lead you to do a lot more tests, even when the lesion is benign, and it may affect your insurability in future. Beware of health screening, even if it is normal. This is Dr. Desmond White. Thank you for listening.